Welcome to LECOM Health Matters. Our guest today is our good friend, Dr. Jaime Babiak. Jaime is now running the Senior Living Center. I don't know her official title, so I should have asked earlier. So let me ask now, Jaime, what is it?
Vice President of Operations for the LECOM Institute for Successful Aging.
And she does a wonderful job at it. So thank you, Jaime, for taking care of so many people. How many patients do we have? How many beds do we have filled now that you take care of?
So our nursing homes, we have just under 400, and our personal care homes, another about 250.
Yeah, that's just a wonderful work to those folks who really need it. So thank you, and Dr. Lynn, and all that you do in taking care of the elders. But our job today is not to talk about that. It's to talk about the infamous new booster that's coming out. I think, Jaime, what I'd like to do is to clarify what I think is massive confusion about it, just by starting with a couple simple questions and then go from there. First off, it's available, I believe, the end of the month, beginning of October.
We haven't seen shipping just yet available for what is the Pfizer version and then also the Moderna version. So hopefully within the next week or so, we'll see delivery and shipping available to get it by the beginning of October.
And then once we have shipping information on it, we'll pass it on to our different audiences, and I'm sure it'll be available at our various clinics and places like that.
Yep.
So it's people can get it. I guess the real question is, I was reading somewhere that not enough Americans got the other COVID boosters, something like less than 20%. I don't know if that number is accurate or not, but should we get this booster, or does it depend upon age? Does it depend upon health? Who should get it?
So currently the recommendation is anyone ages 5 and older should receive this new COVID update. And it sounds like, from what I've been reading, that they're no longer terming it booster, but more of like a COVID update, so that just like the flu, we're keeping up with the various virus types and strains that are out there. Based on what's out there, the vaccine will change accordingly. So it sounds like we're looking at a COVID update, potentially annual vaccination.
When we say, Jaime, everyone should get it. Someone asked me the other day that a person my age, they were going to get it. They want to get it, and they understand the need to get it. But then they asked the question, well, when I go to get it, should I get, they had missed one of the other ones. I forget which one, but they missed, the one of the other boosters. And their concern was, should I tell them I missed booster 4 or 5, whatever it was, or get this one? They didn't know what to do.
Yeah, that can get pretty confusing with all of the different recommendations that have been out there. Essentially, they're recommending anyone that hasn't gotten something within the last 2 or 3 months, regardless of missing things along the way, to get this one, ages 5 and up. So if you had a boost or had a dose of, one of the vaccines within the past 2 or 3 months, or have had COVID, they're saying, to leave at least that 3-month or so window in between.
So it's basically show up and get it regardless of your vaccine status, unless it was really very, very recent. You're safe to get it. What do we know about this vaccine and what it hopes to accomplish when it's injected into people?
So the new one that's out there for both Pfizer and Moderna is a monovalent vaccine, as opposed to the bivalent that we had previously. So those ones that were available are no longer being used. And this one is targeting the new strains that...
Can I stop you right there, Jaime? When you say mono as opposed to bivalent, what does that mean?
So just targeting one virus strain group versus 2. So the bivalent is, going to be more than one, the monovalent just one group.
Okay, so I cut you off. I'm sorry, but when I think the audience, when they hear those technical terms, including me, wonder, well, what's the difference? So it's going to target one virus, but what's it hope to do?
Hope to get more of an, herd immunity, keep up with the strains that are out there, just like the annual flu vaccine does. It looks at what types of flu they've had, in other areas of the world, and our vaccine is created as a response to that. So hope to kind of give that same, annual coverage, because even though you get the flu vaccine, each year, that coverage still builds upon itself over time.
There were concerns last time the booster was administered about side effects. The first common reaction is basically pain, etc.
Yeah, just the normal local type redness, pain, some muscle achiness potentially. It did seem like with the other COVID vaccines, just like with COVID itself, everyone had a little bit of a different immune response to it. So I'm sure it's going to depend a little bit on, if you've had 3 vaccines plus COVID twice versus somebody that maybe hasn't had anything. And I think there are some folks out there that, haven't. So it's probably going to depend on, the type of immune response you've already had towards the virus and some of the different strains, but hopefully just the normal local site reactions.
Right. So basically, you might get a little nauseous, a little sick the day that you get it, and it should pass by the next day. I know there was serious concern about heart issues relative to the other vaccines, and I don't know what the research ended up concluding. But do you see any problem with that? Any type of myocardial issues involved with the vaccine?
I have not seen any attributed to the vaccine. I know a lot of folks, having had the COVID virus itself, seem to have had longer, COVID type effect reactions as opposed to the vaccine inducing ones. Some folks that have had COVID have had some longer cardiac effects associated with it. So I think anything that the vaccine does is probably still better off than what the virus itself can do, potentially. Obviously, everybody's a little bit different.
So surely, Jamie, getting the vaccine outweighs any potential side effects people are going to encounter. And so they should, in a sense, be concerned about those, but that should not eliminate them from going. Is that a correct statement?
Right. Yes.
Now, how about when they get the flu shot? Can you get a double whammy and get both together, or do you advise stretching them out a little bit?
You can definitely get a double whammy of COVID and flu. Usually just recommended to get one in one arm and one in the other arm. Certainly you can spread it out, but I think, spreading it out from an immune response is, I'm not sure exactly the benefit of that, but I know we've definitely seen folks that spread it out that don't end up coming back for whatever that second one was, whether it be flu or COVID. So it's definitely okay to get on the same day. Might just have 2 sore arms.
Will we be doing that when we offer it, or don't we know yet? Will we be offering both at the same time if somebody wants to persecute themselves that way and get both at the same time?
Yep, at our LECOM Center for Health and Aging on Shaper Avenue, we do have both COVID and flu. We'll be offering during our normal walk-in hours, which is Mondays, Wednesdays, and Fridays from 9 a.m. to 4 p.m. And we have a number of clinics that we're going to be doing throughout the region. Some have elected to have just flu-based clinics, and some have asked if they could do both flu and COVID. So for any of those that are asking, we can do both at a clinic site.
And just to remind our audience, I know the questionnaire that they fill out for the flu shot asks the question, but if they're over what age do they have to get the high test flu vaccine?
Over 65.
Yeah, and I know it's not called high test, it's called something other than that.
Yeah, close enough.
There's more in it for us older people than get it for the younger people. Jamie, I think it's fair to say that there's a lot of vaccine weariness in the country. Clearly, when you look at the numbers of people who got shots, how do we deal with that? How do we convince people that this is really something that I believe is free, the flu shot for sure, and I think the COVID vaccination is covered by insurances. Is that correct?
Right. Yeah, the flu shot, we purchase it. It's free under, just about every single insurance plan as a wellness type preventative measure. And it looks like the COVID's going to be the same. The COVID vaccine has been no charge under all of the federal programming that goes along with it. But currently with this new vaccine that was approved last week, there is going to be, we as a entity have to purchase the vaccine, but it sounds like it's going to be covered as a wellness measure under most insurances like the flu is as well.
And what, Jamie, would you say to people who are just vaccine weary? So I don't want to bother with flu. I don't want to bother with this COVID-19 because they're going to come up with something again next year, and I'm just fed up with it. What would you say to those folks?
The biggest thing that I, would say is just, remembering those around you who might not respond like you will. So, if I'm a healthy individual and I feel like I don't need it because I, go to my doctor, I eat right, I exercise, I do all the things that I'm supposed to do, and I've had the flu and it didn't bother me, why bother getting the vaccine? Or I've had COVID and same thing, I might interact with people that might not respond the same as me. So, in the unmasked world that we're hoping to stay in, I think we just have to keep those things in mind, whether they're young children. We saw a lot of RSV. We have the new RSV vaccine now too, that is 60 and over. But just keeping those things in mind with elderly population, immunosuppressed persons, children, everybody reacts differently, and we really don't know how someone is going to experience that virus or sickness until it happens. So just having that extra protection for you, in contact with others, in hopes that we can all stay unmasked for the foreseeable future.
And I think, as you mentioned earlier, that we really are protecting other people, and it's time to not be selfish about this, because the people that you said earlier, we want to stay mask free. And so part of that process of staying mask free is taking on the responsibility of, being careful and being guarded of one another and getting the shot does that. Now, you mentioned RSV. We hear that floating around too. What is it, and who should get it?
So RSV is respiratory syncytial virus, and it is something that predominantly affects children, infants, and older adults. So there is a new vaccine approved just for the older population, 60 and over. That is something that I don't see any reason why you couldn't get it on the same day as your COVID and your flu, but by all means.
Not three on the same day. For sure, you'll have to go home and go to bed.
So we probably don't have studies to show that. So, something that you might want to consider separating. But it is available. It is for 60 and over. It is a Medicare Part D benefit. So I know there's a lot of pharmacies carrying it, and we're looking to carry it, for some of our clinics as requested as well.
And it helps prevent diseases of the lung, if I understood you correctly.
Yep, another respiratory type disease and illness.
And you would advise children and anyone over 60?
It's only the vaccine that's out currently is only approved for 60 and over. 60. So there's nothing yet for the child population, but those are usually the ones, more susceptible to that.
Now, the hardest question of this interview, Jamie, is this: how do you see COVID affecting us this fall and this winter? I know it's an unfair question, but you read in preparation for this, I did a little bit of work, and you see all the numbers, and sometimes it's hard to make any sense of them. What do you think from your chair, from what you see?
We've already seen some COVID numbers, some positive tests creep up, I think, a little bit. I think as far as the community overall, we're not seeing a huge surge, so to speak, but we've definitely seen it. As people start to move indoors and things like that, I would imagine, school's back in session, we're going to see it a little bit more. I'm hopeful that, if everybody practices their prevention and we remember the things that we, really instilled at the beginning of COVID with the hand washing, and, if you're sick, stay home. I guess gone are the days where we used to come into work not feeling so hot and everybody, looks at you now when you've got a stuffy nose. So if we can keep those things, happening where, if you don't feel good, be honest about your symptoms so we're not spreading it, put a mask on, washing our hands. I'm hopeful that we won't see a ton of it, but I wouldn't be surprised if we do see a little bit more this winter. Now it'll be a little bit harder with the, unmasking to differentiate. So that might be the hardest part of it is, we've offered the COVID testing for a long time, but differentiating between COVID, flu, and RSV with some of those, same general respiratory symptoms is probably going to be a little bit difficult too.
Well, people, I think, as you well pointed out, simply, Jamie, should be cautious. And these tools are available to protect themselves and to protect other people. If people have questions or concerns, they could just call us, Jamie, and that number would be?
Yes, we have our flu line. I'm going to have to get it for you here. I wasn't ready for that, but that's okay. So we have our flu line, which you can call at any time, 814-488-3939. Mm-hmm. And our clinics, we have Monday, Wednesday, and Friday from 9 a.m. to 4 p.m. at the LECOM Center for Health and Aging, which is 3910 Shaper Avenue.
Okay, and we'll take good care of people. If they come, they can get 1, 2, or if they're really buckets, they can get, you could actually get 3 RSV, COVID, and flu.
There have not been studies because of the RSV being so new, but I don't see any reason why you couldn't if you're so brave.
But they should get it at the end of the day and go home right after that's over, just in case. Jamie, thank you for this opportunity. Thank you for helping educate the community. And you do such a wonderful job doing just that. I mean, our services are there for people, and we hope and pray that they take advantage of them. So as you said, better than I could say, so that we protect not only ourselves, but others. Thank you, Jamie, for being with us. Our guest today has been Dr. Jaime Babiak. This has been Monsignor David Rubino from LECOM Health Matters.